They said they were going to sort out the NHS, get rid of the abysmal long waiting list that we suffered under the Conservative government. They did, of course, give huge pay rises to doctors and nurses after endless strikes. And apparently, it's all been for the betterment of this country, because over 2 million extra NHS appointments, including for chemotherapy, radiotherapy, endoscopy and diagnostic tests, have been delivered as government has taken its first step to fix the NHS 7 months early. They've got there ahead of time. Well, that's according to the press release coming from Number 10. But like most things that come out of Number 10, regardless of who's in charge, you sometimes have to dig into the data and take it with a pinch of salt. And actually, when you look at this, the new data that confirms the government reached the target 7 months earlier than promised, it's actually comparing to a period of time when all the doctors were on strike anyway. Oh, what do you make of that? Well, let's find out what Professor Karol Sikora makes of it, Medical Director of the Rutherford Cancer Centres, someone who works in the private sector, who've had to do a lot of the heavy lifting when it comes to picking up the NHS slack. Great to have you on the show, Karol. What do you make of this announcement? Should we welcome it? Are we beginning to see light at the end of the tunnel, or is this, well, a little bit dubious?
It's pretty impossible to judge. You can't verify it. It's typical political posturing on a time when there's not that much dramatic news out there. It's all discussion about peace in various parts of the world. And it's a great story to put out. But when you look at it, you can easily fiddle the statistics. For example, if I was in a hospital or a chief executive, I had to make a return on number of appointments. Why don't I just count the blood tests as an appointment? And that would double the number of appointments seen in the last week. I mean, it would just, most patients get a blood test at some point. If you count that as an appointment, then obviously you do well. It just lacks any credibility. The report coming from Number 10, it says cancer treatment, fantastic, and Starmer's quoted as saying that. But you know, the 62-day wait is not being met in about 30% of all the trusts around the country. So I'd take it with a pinch of salt, Alex, at this stage. Let's see some data.
What we do know is, of course, when it came to elective surgeries, elective tests, all the rest of it, that they were the things particularly impacted by the doctors' strikes, and there's a huge amount of catching up to do, and they've had to rely heavily on outsourcing that to the private sector to get that done. Equally, I would imagine that a lot of people have chosen to go privately anyway because they've not been able to access those appointments. We are hearing Wes Streeting talking about actually creating more competition by getting private companies into the NHS and using the private sector a lot more. We also know that some of the sort of meagre growth we've got in the UK economy, a lot of that is actually down to medical insurance. That's an industry that's booming. But is this really the solution? I mean, should they just sort of be looking at the model of the NHS as a whole, say that's not working? Is it about just saying to the private sector, look, we're going to desperately need you guys, and are they doing that?
No, what we need to do is get rid of the bureaucratic nightmare that's the NHS. It really is a bureaucracy. If you review a patient's notes now, and I've been in the business 50 years as a doctor, so I can remember the past. Someone was in charge. The doctors were in charge of the patients, and they'd make sure they got a good journey through the bureaucracy of the system. Okay. You know, when I was first a consultant, the costs were much lower than they are now of treating people, and most people were a lot younger. You know, the average age of a cancer patient when I started in cancer medicine, which is my specialty, was about 55 to 60. Now it's 70 to 75. So things have moved on. And of course, the older you get, the more disease you accumulate through your life, whether we like it or not. So it's more complex treating. But going back to the problem, the whole machine of the NHS is fundamentally a bureaucratic quagmire, and of multi-professionals that are not working as a team properly. They're doctors, the nurses, the physiotherapists, the radiographers, and so on. We've got to get back the idea that we're doing something. If you want to get your car fixed, you don't want to get involved in disputes as to who's going to take the spark plugs out. You just want the job done. It's the same with medicine. And I think doctors have really lost the plot. The current generation of young doctors are now clones of each other. And whilst they're technically competent, they don't really take responsibility for running the service. And that's what we've got to get back to.
Do you know, it's funny you say that. I often think these days when you look at a lot lot of young GPs that they're just good at Googling stuff. I wonder how much involvement they've got with practicing actual medicine. Could the solution be creating a lot more polyclinics? I ask that because my experience living on the European continent, where that is the model, under health insurance model as well, we're talking about Brussels here, is that when you go and see the equivalent to the GP in the same practice, you have the physiotherapist, you've got phlebotomy, you've got all these other sort of, you know, built-in services where one assumes that they coordinate and they discuss with each other at the end of the day.
I think that's right. And someone has to be in charge. It doesn't have to be the doctor. It could be one of the other health professionals, but someone has to be in charge. And that means not getting paid more necessarily. It means taking responsibility for the service. And that's the problem. No one's taking responsibility for the service. And most people are demotivated. They come into it with great excitement. To get into medical school these days, you have to have the top grades and ridiculously high. You don't need to have 4A levels at star level, for example. You could take people with lower, if provided they're hardworking, dedicated, and willing to do it. And leadership is sadly lacking in healthcare here. If you go into Europe, as you say, the system's different. There's still a health service. People don't die on the streets because they can't afford to go into a hospital. There are systems to protect people. That's what we call, availability of care for everybody. And so we don't have to have an NHS. We can do it in different ways. We have to have a social insurer, and that's how France and Germany work. And it works much better. In cancer, for example, if you have symptoms that make you think you have cancer and it turns out to be the case, you'll be treated next week. Whereas here...
And that's the most important thing. I mean, Sam, that is, at the end of the day, when people are hand-wringing about save our NHS, it's not our NHS when you can't get an appointment. It's not our NHS when you're failing to get the diagnostics that then sentences you to death.
Yeah, and politicians are remarkably squeamish about touching these things, despite the fact when you sit down with them, when you have a conversation with them privately, they all know the NHS's problems. They know that every time they try and do anything, every time they chuck a load more money at it, all that happens is the bureaucracy grows, the not quite doctors grow, the people that aren't either nurses or doctors but are working in there. All of the problems that come about with this state system, every politician knows it, and yet none of them will do what they know is necessary.
That's the problem with having a state run anything. Thank you to Professor Karol Sikora.